How exactly does one know whether or not they're dealing with issues related to their thyroid? There are two general types of thyroid dysfunction. One being when you're producing too much thyroid hormone, and one being when you're producing too little. In this video, we're going to cover the too little side, aka hypothyroidism, just because it's the more common of the two. However, these two have signs and symptoms that can overlap, just so you're aware. Hypothyroidism is a condition with an estimated prevalence in the general population up to 3.7% in the United States and up to 5.3% in Europe, depending on the definition that they use. They also state that approximately 12% of the adult population has subclinical hypothyroidism. And that's an important point. It's important because subclinical means that these patients usually do not yet have any symptoms present. However, their lab markers are starting to change slightly. I'm not going to dive real deep into how exactly the thyroid operates in this video. I have other videos talking about that. But for those of you who already know or have watched other videos, subclinical hypothyroidism, in that instance, your thyroid will still be putting out sufficient amount of thyroid hormone, but there are upstream changes, meaning your TSH has become elevated. So if you don't yet have any symptoms, why would that be such a big deal? I'll tell you why. It's a big deal because the majority of primary care providers will not begin with any treatment strategies and essentially just wait for things to progress to full-blown hypothyroidism before actually intervening. Why do they do that? Well, because they're working within a limited model. Their only tool that they have available at their disposal is prescribing thyroid hormone. But if thyroid hormone is not yet low, well, then obviously they're not going to give it to you. Why this is important is because if we can intervene sooner, as you can probably imagine, the outcomes will be much greater. Because ultimately, subclinical hypothyroidism will develop into full-blown or overt hypothyroidism. It's just a matter of time. Now, what do hypothyroid patients actually look like? What kind of symptoms are they complaining of? Well, common symptoms of hypothyroidism in adults includes things like fatigue, lethargy, cold intolerance, weight gain, constipation, and dry skin. Another important point to make is that these symptoms are non-specific, meaning there are so many illnesses that can lead to these exact same symptoms, which makes the diagnosis a little bit more difficult. In a population-based case control study, hypothyroid patients suffered mostly from tiredness, dry skin, and shortness of breath. Once again, these make it difficult to diagnose because, as of today, who's not tired? And when you live in Colorado like I do, who doesn't have dry skin? Now, back to that study, they state that among 34 symptoms investigated, only 13 symptoms were statistically overrepresented in hypothyroidism, and none of the 34 hypothyroidism-related symptoms could be used to identify patients with hypothyroidism. Hopefully this just goes to show the importance of keeping an eye on your health and then seeking out an expert in whatever that field may be. In this case, someone that is keen on working with patients who have thyroid-related issues. And lastly, like if you do, subscribe if you haven't, and I hope you tune into the next one.